slight background on dConnect. We're a newly established digital health innovation hub at Dundalk Institute of Technology, and we're funded by a lot of local and regional supporters. Our main funder is Enterprise Ireland. We also have a lot of businesses and local government funding as well to stimulate growth in this area and across Ireland. Across digital health, our mission is to stimulate and foster and enhance innovation in digital health, to create enterprises and jobs and services, products and help and aid that will be beneficial to the healthcare system as the burden of healthcare increases with our aging population, not just in Ireland, but across the world. There is a great, I suppose, optimism around the fact that we can now digitize healthcare and we'll be able to take some of the burden away from the clinics and hospital setting so that people are able to be monitored at home and self-care. So we are here as the go-to to support large and small enterprises that are in this space. We're building a bridge really between maybe the businesses that are moving into this healthcare space or those who are digitizing, who have already been working in healthcare and are digitizing, and the third level sector and innovators and entrepreneurs who are coming up with some of these new innovative technologies to aid society and general health. We're creating a cluster. We probably, I should write, we have created a cluster. So we have almost 600 people who are affiliated with us now across connected health and well-being. We're supporting startups through mentoring, everything from getting them investor ready to prototyping. We offer that service as well for people who may not have an in-house capability in software and hardware. And we're helping to commercialize research, not just out of Dundalk IT, but elsewhere. And all of this innovation activity at the early phases is of great benefit to investors in the space and also to the larger businesses who probably don't have the same amount of flexibility to innovate and are always looking for opportunities in this area. And so our audience is broad. As I said, we're supporting startups in various ways. There's a lot of expertise on the team in terms of entrepreneurial, I suppose, just being entrepreneurs plus mentoring entrepreneurs and getting entrepreneurs ready for investment and bringing them through the process to be ready and to acquire funds and just model out their business and the various aspects of it. With engagement with people who are providing funding, the capital and investment sector, but also with government who have been extremely supportive. And we've relationships then with the HSE and also with private hospitals, because I think having a clinical voice is extremely important for us, and to guide all of the innovation, we do need to understand the clinical voice there and also that of the user and the patient journey. And then, of course, the entrepreneurs and the universities providing that innovation. And again, the SMEs and the corporate entities really interested and very supportive, I have to say, and interested in the digital health sector and advancing that and looking to the innovation that they see in the ecosystem. So our strategies really is to build out the cluster, and that's building. We launched last month after we've been established for a number of months, and it's right across, as I say, enterprise, the healthcare system, public and private, our funders and also society. And we are working on different collaborative, I suppose, groups and projects with various different people from community organizations to large and small businesses. We're a knowledge hub, really. I guess we're a go-to for people who need support and who need information. We're working on a project to look at the trends across healthcare in terms of, the cutting edge at the moment worldwide, comparing that geographically and looking at even mergers and acquisitions in the space. So staying on top of things, but also locally being able to provide support and expertise to the needs of the businesses. And we're very needs-led as an organization. Would support a lot of early stage businesses as well. And, we've a couple of serial entrepreneurs on the team who have provided mentorship to early stage businesses in the past. And we're very much doing this on a sort of a one-to-one basis at the moment. And we'll move beyond even some of the workshopping that we do to programmatic activity over the next while. And in that workshop series, with this one included, we've focused on digital transformation. As I said, everybody is kind of having to look at their digital, I suppose, portfolio, or their transformation to use of digital tools, or the people they're targeting are now moving digital and they need to be prepared for that as well. We do see that, coming out of the Northeast, but also out of Ireland, we can be very much global from the outset. We, of course, large connections and great advantage to be very close to Northern Ireland here, and connections cross-border. But looking at opportunities now with Horizon in Europe, and also connections. I've worked and lived in the US, and so there's plenty of opportunity for Irish business to be big players there as well. So thinking global from the outset is our mindset on that. The team and reach out to any of us. Myself and Sarah have both entrepreneurial, I suppose, backgrounds, and I've worked in the corporate world for a long time, particularly in medtech, and also work to invest and to mentor startup and early stage companies. Sarah is a serial entrepreneur and has also worked with early stage businesses as a mentor, and she's a community and education manager. And then Sarah Fell is a wonder with technology and is running a number of projects, prototyping for early stage businesses. So reach out to any of us. Our emails are here.